Maria, the sequence is like that. They will introduce both of us. Then I will welcome you, and then I will hand over the session to you.
Okay. Okay. Fine.
Yeah.
Good evening, doctors, and thank you very much for joining today's webinar. And I'm Dr. Prachi from Shield Healthcare, and I welcome you all. So we have very own Dr. Ritu Santwani, the very beautiful and always energetic. I'm very happy and privileged to introduce her. Ma'am is IVF specialist and founder and CEO of 360-degree Healthcare Studio. Also co-founder of MAM and board member of SWWC. MAM is practicing in Pune. And yet again, we are coming with Myths Back webinar. Next slide, please. I'm again privileged to introduce our speaker, Dr. Maria Motiwala. Ma'am is consultant at various hospitals in the Ruby Hall Clinic, Jahangir Hospital in Lads, and Budhani Hospital in Pune. Ma'am has arranged various conferences, and she is also honorary treasurer of AOI Pune. Ma'am has special interest in clinical assessment and management of vertigo, sleep apnea, management of endoscopic sinus surgeries, etc. So with this, I hand over this session to Dr. Santwani ma'am. Ma'am, over to you. Thank you very much.
Yeah, thank you, Prachi. And thank you, Shield, for providing the platform. Knowledge always increases by sharing. With this motto, I started this program at the time of the lockdown period. And I can say by the interest of everyone and by the grace of the God, this program is still rocking. Everyone waits for this program every week. So today we are having the stalwart, none other than my very dear friend, Dr. Maria Motiwala is here. Maria, a very, very warm welcome to you. Maria, I am sending these lovely roses to you. So this is virtual, at least you can get the some fragrance.
Thank you. So, thank you, Ritu. Thanks a lot. Virtual, but I got it. Thank
you. Friends, for Maria, I have actually no words to say. She's not only the master in her subject, but she's a very beautiful soul. Huh? Always ready to help everyone. Whenever you need her, you only just have to give her only one call. And she never says no, though I know she's also very busy, and we are really thankful to her that for today's webinar also she accepted the invitation. I know she is traveling a lot these days. So today we are going to discuss a very, very important topic, that is the ENT issues in the pregnancy. Being we all gynec, we are having a lot of queries with the some or the other ENT issues, that what the drugs we have to give, what not to give, how to treat this. So let us first hear from the Dr. Maria, and then later on we can ask some questions. Dr. Maria, sorry, I am used to say her Maria because she's a very close friend of mine.
Only so Maria,
meanwhile, Maria, a lot of friends have joined from Bangladesh and Kuwait. So I'm getting messages on the YouTube, all are welcoming you. So now all the dais is all yours. First, you can take your talk, and then later on we can have some questions, whatever we will receive.
Should I share my screen?
Yeah. Your voice is not coming properly.
1 minute.
It's very less.
Let me increase the volume.
Yes. Now perfect. Now
it is okay.
Yeah.
So here, I'm Dr. Maria Motiwala. I'm a ENT surgeon practicing in Pune since last 18 years. So today we know the topic. The first is ENT issues in pregnancies and how to tackle it. So before wasting time, I will start. Everybody knows the ENT infections and all that, but the main highlights which I wanted to highlight today, and which is so common, and we have seen such patients, and I'm very sure the pregnant lady or the gynecologist must be tackling this or having this type of patients in pregnant ladies. So first, directly we go to the causes of whatever the ENT issues are there in the pregnancy. The first important is hearing impairment and tinnitus. The patient definitely complains a little, like especially in the third trimester when they come, they may tell you, okay, oh, there is a hearing loss and there is tinnitus. Then first, let me go through all the causes, whatever, like all the main important ENT issues while pregnant in pregnant ladies, and then we can elaborate it like, one by one. So the first is hearing impairment and tinnitus. Second is vertigo. Third is Bell's palsy. Then comes most common, which we can see, rhinitis and sinusitis, especially the allergic cases, what we can see, it increases during pregnancy. Then comes epistaxis, then gastroesophageal reflux, ear infections. And the last three are the physiological problems. These are the ENT issues, but it is because of the pregnant ladies or the physiological cases. What we can see is laryngopathia gravidarum, dialism gravidarum, and pregnancy nose. So these last three are physiological. So we'll go one by one. First, we start the ENT issue, which is most common in pregnant ladies or in pregnancy, is hearing impairment. So now hearing impairment also we have divided what is the causes of hearing problem in pregnancies. The first very important is eustachian tube dysfunction. I'm sure every gynecologist must be having such type of patients, which is the most common thing. So now the cause of this is, it is because of the increase in the mucosal edema. And that's why they will always complain with nasal obstruction. And because there is nasal obstruction, there will be fluid through the eustachian tube and settling in the middle ear. And they will have middle ear effusion. And in some cases, they may complain with acute otitis media also. Now, what is the treatment? Usually we get panic. I think pregnant patients, they get really worried. What is the reason of this? Believe me, don't overtreat them. Reassurance, steam inhalation, saline drops, and any antihistaminics like fexofenadine or levocetrazine in some cases. And they will go slowly down. The symptoms will go slowly down. Second comes otosclerosis. So as we know, the estrogen effect is more during pregnancy. So the otosclerosis, what happens, the calcium deposits, because of the estrogen effect, the calcium deposits are more between the ossicles, and that leads to otosclerosis. In this now, the treatment is only sodium fluoride. So we give that, but it is extremely contraindicated in pregnancy. Never use sodium fluoride in that. Only you can do counseling, and you have to do maybe a surgery, maybe after postpartum. That is only the treatment what can be done. Then the third is sudden sensorineural hearing loss and tinnitus. Now, there may be certain causes of this, like maybe you can have because of, now why there is a sudden degeneration of the nerve, like the sensorineural hearing loss, what happens? So that also, that it may be due to toxemia, hypercoagulability, and sometimes viral infection like cold, cough. Sometimes sudden viral fever also can attack the sensorineural nerve and give you the hearing loss. So now the treatment is steroids for the sudden SN loss and tinnitus. But usually we avoid, or we try to give them in the third trimester. And usually such cases happen since more in the third trimester, when there is a large volume and when there is more hypercoagulability. So first we go to the hearing impairment, then we come for the causes Bell's palsy. Now there is a perineural edema around the nerve, and there is also sometimes viral infection. Due to that, they may get sudden, they may complain of, I'm having difficulty in closing the eyes, or my mouth is deviated, or sudden symptoms may come in pregnancy. So the treatment is again prednisolone. That is more effective or more better to give. It is in the third trimester. So that is like, then we go for vertigo. Now, vertigo, there are, as everybody knows, there can be menias, then can be benign paroxysmal positional vertigo, then can be perineural neuronitis, vascular neuronitis. So this can be, lot of causes are there. So if the patient with pregnant having a cervical spondylosis or having a cervical pain may give it a benign paroxysmal positional vertigo. But most common what we see is in the Meniere's disease. So in that we have a fluid retention, and this is because of the estrogen and progesterone effect, and the patient may complain of giddiness. In any, I think more we have seen in all the trimester, first, second and third. So the vertigo or the giddiness complaint is very common in pregnancy. Treatment will be dimenhydrinate and meclizine. These are the safest options. So try not to use cinnarizine in much cases, except in the third trimester. But meclizine is very safest in vertigo cases. And for vomiting, if they have, metoclopramide is also good. Avoid diuretics because this will give you hypovolume, hypotension, and all that. So as far as concerned, when vertigo concerns, avoid diuretics in pregnancies. Then we come the most commonest, the rhinitis and the sinusitis. So what we see is the rhinitis because there is a vascular engorgement, increase in the mucus glands, more activity is there, more exposure to the viral infections. So that may lead to rhinitis. And if rhinitis is not treated, sometimes just the pregnant ladies, they don't treat rhinitis like, it will be okay, and then it may lead to sinusitis. And that is a complication of rhinitis. We get a sinusitis and they may complain of headaches, blocking of nose, thick nasal discharge. So these will be the symptoms for sinusitis. As we know, I think everybody treats the gynecologist. Everyone is treating that. Simple, give oral decongestants, give antihistaminics, intranasal, topical, usually preferable saline drops. But in severe cases, you can use xylometazoline and decongestants like that. And definitely antibiotics which are safe, like usually we use azithromycin, coamoxiclavs, and definitely cephalosporins are the safest in pregnancies. Then we come to the cause of epistaxis. So that is because of the toxemia and vascular congestion. And definitely because of hypertension, if they have the blood pressure is shooting in pregnancy, that may lead to the epistaxis. So again, the treatment is saline drops, antibiotic, neosporin ointment, decongestant, antibiotics, and in very severe cases, which is not getting control with oral medicines. In some, I think I have done one nasal packing in pregnancy, pregnant lady. We have to take him into the operation theater, and under local anesthesia, we have to do a nasal packing because continuously she was bleeding since a week. But if the BP is under control and taken care, then it works out with the oral treatment and nasal drops. Then we come to, this is also commonest cause, gastroesophageal reflux. So that is a hard one. They complain of sore throat, hoarseness of voice. And usually I have seen patients complaining of, in pregnancy, they come with reflux pharyngitis. That is very common, which I usually see. They come with throat pain, and that is a typical reflux pharyngitis, what we can see the symptoms of that. So for that, we have to advise to the patients, like they have to have small frequent meals. Then antacids, we can give histamine blockers, and definitely PPIs, what we usually recommend in pregnancy. But main important is this symptom can lead to laryngitis also, pharyngitis. So this has to be really tackled fast. If they have an acidity symptoms, try to start from beginning only, give them antacids and all that, so that the reflux is less and the throat infections become less. Here comes ear infections. So I've already spoken about that. It is due to the eustachian tube block. There is a mucosal edema, and that leads to the fluid behind the eardrum, and which leads to secretory otitis media. So the treatment, what we do is, first we do audiometry, we do impedance audiometry, check how much fluid is there. If it is a flat curve, then try to give them oral decongestant, nose drops to open the eustachian tube, steroids if it is in the third trimester, if the patient comes. And in very few cases nowadays on OPD basis also, we can do a myringotomy. Just do a puncture on the eardrum so that the fluid gets released and the patient problem is solved. Otherwise, suddenly at night, they get sudden complaining of severe earache. So that is the most common cause of for the ear infections. Now here comes, this is a physiological typical, this laryngopathia gravidarum. So everybody knows that because of the physiological symptoms, the hoarseness of the voice is very common. Like they complain, oh, my voice has totally changed. So many patients came over, my voice is completely changed. What is the reason? And they get worried. So just counseling them, give them hydration, give them steam inhalation, tell them to have steam inhalation every day. And if they are singers, try to avoid singing. That is very important. If they sing, again the hoarseness, against the mucosal, laryngeal mucosal edema will increase and the hoarseness will increase. So avoid singing during pregnancy. Here comes stylism gravidarum. So this is because of excessive salivation. The patient get physiological dyspepsia due to increased salivation. So they may complain of vomiting, some discomfort. They may complain of foul smelling. Suddenly a pregnant patient comes, okay, my throat is smelling. I feel all the time my mouth is having a foul smell. I try to brush so much. I do so much gargling, but still that foul smell is there. So it is just a physiological thing because there is an increased salivation. There may be not infection in the throat, but still if we found that is nothing except that they have a foul smell. So just tell them to have some eyes whenever they have that foul smell, have chewing gums. That will help them to reduce their or to stop their symptoms. Pregnancy nose. I'm sure everybody must have heard about it. Ritu, about the pregnancy nose. Yes, the patient complains now nose has become very big. Especially the young ladies or young women, here they come, they get pregnant. Suddenly my nose is big. Have I to operate this? Like, after postpartum, do I have to operate? What is the reason of this becoming wide? So it is just due to increase of the plasma volume. Nothing to do with that. There is some pathological there. It is just an increased plasma volume. And so let them after postpartum, definitely slowly the blood volume reduces and their nose shape becomes normal. This is there. So here we comes about all the ENT issues during pregnancies. And I have tried to cover as much as possible what we see in practical cases, this is the practical point. There are many, many causes, but which we see day to day, that is more important, and which we have to tackle it every day, day to day, that is more important. So that is
very, very precise presentation, Dr. Maria, and you have covered each and everything. So will you stop sharing now?
Yes,
so we can come on the screen. Yeah. See, a lot of comments we are getting. My friend has joined, Dr. Shivani from the Delhi. She is also writing the excellent presentation. Lot of friends have joined. Dr. Maria, one question. This is regarding this Bell's palsy in the pregnancy. today only I got one patient. She was telling me that in the last pregnancy, she has got the Bell's palsy when she is going to her mom's place at the time of the 6th month in the flight. So now again, it's the 4th month. She's so scared कि वापस तो ऐसा नहीं होगा again. And she was very much worried because, of course, at that time, they have to give her some steroids. So, and the patient herself is a biomedical engineer. So all the time she has a threat of cleft lip, cleft palate. I explained him 1,000 times, but still she is having a lot of confusion in her mind. So is it something like that for Bell's palsy prevention, something we can guide or something we can counsel to the patient?
Yeah, see, this is due to, as I told you, the Bell's palsy happens because there is a perineural edema. So mostly this is like, this will be not permanent, but this will be a temporary because the edema increases. So for them, try to give them exercises like, like for the balloon, just have like, do the cheek treatment or whatever the exercises which we give for the Bell's palsy. Just tell them to do that. So that will avoid them, and treat immediately any viral fever, because sometimes little cold or cough also, when the virus attacks the like the nerve. So suddenly they may get the deviation of the mouth and closing of the eyes and leading to Bell's palsy. So only exercises, proper hydration, and some few exercises for the Bell's palsy and reassurance. That's all what we can do. Nothing else like much to do that.
Okay. Thank you so much. There is one question in the chat box. Yeah, from Dr. Shivani. She is writing, patient came today with vertigo in pregnancy, approximately 32 weeks gestation. What can be done?
So I think, as I told, if it is coming, this vertigo symptom comes after a viral attack. First of all, ask the patient whether she had a cold, cough, or recently in a 1 week's time. If it is there, this is mostly a vascular neuronitis. Okay. So the viral attacks the nerve and you are getting the vertigo. Second, that can be Meniere's disease because of the congestion and that. And third will be paroxysmal positional vertigo. So the history is very important to know what is the cause of it. If it is a viral fever, then it is definitely because of vascular neuronitis. If it is because he is having osteoporosis and cervical spondylosis, then definitely a positional vertigo. And Meniere's disease is a very, if the patient, we find that, she's psychologically very upset and very disturbed, hormonal imbalance is there. So during that case, Meniere's is there. So definitely she can start with meclizine. That is the treatment, first line of treatment which should be given. And wait and watch. Otherwise, she has to take, we have to give her Apley's maneuver. She has to send to some ENT and do the Apley's maneuver so she can be benefited with some exercises.
Thank you, dear. And one more query. This is also from my side. We are getting all this corporate patients. So the patient approached me last Thursday, and they're young couple, 23 and 22. So this is the first pregnancy, and the guy was telling me that my wife has always a tendency for epistaxis. So now her due date is coming. So is it like that? Why not you are suggesting for the cautery? So I told, what's the need for the cautery now? Nothing like, it's a small epistaxis and very easily it is controlled by the pressure and all that. So they have consulted some of the ENT doctor in Pune only. I will send you the name also later on. So she told her, yes, please get admitted and we will do the cautery. So what's the relevance of the cautery? I want to know from what's your opinion?
First of
Actually,
all,
no nasal polyp, nothing like that. I have seen the prescription also. Nothing is mentioned like that.
has it been done? Any nasal endoscopy has been done, Dr. Ritu?
No.
So
No.
how the thing is, we on the OPD basis, yes, we do a nasal endoscopy.
Uh-huh.
If we find any bleeder there,
Yeah.
then
Yeah.
definitely it's a small, just on the earbud or something, just apply a diluted acetic acid or something and the bleeder will stop. But unless we don't do nasal endoscopy and we don't know there is an active bleeder, usually what I have seen in pregnancy, when we do a nasal endoscopy, it's a vascular engorgement of the whole nasal mucosa. So it is a generalized thing. And if sometimes the patient has sneezing or just touching the finger inside, and a small vessel may break up and the bleeding may start. So saline drops and little nasal decongestion will help. So in very severe cases, if epistaxis is not stopping, it is all the time through a week, which is causing her hemoglobin to be dropped, which is giving her hypotension. In that cases only, usually we tell them to do nasal cautery in the hospital so that we are ready with the packing, otherwise not
Okay.
required.
Okay. 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 Thank you. Thank you so much. Is it still we are doing that silver nitrate and copper sulfate cautery also?
Silver nitrate is still done.
Okay.
Usually now we don't do much, but definitely in pregnancy we think of it because that is the safest thing. And
Yeah.
it is done in OPD basis, like
Yeah.
telling the patient, a pregnant lady, to get admitted, and that which gives her really psychological this she's undergoing with a new all preparation and everything, and you tell no, you have to admit in the operation and go to the operation theater and all. So we try to do this silver nitrate and a diluted, and especially in pregnancy, try to do, or the patient or senior citizens having lot of problems like hypertension, diabetes, cardiac problems. In that cases only, we in very few cases are to be done with that.
Okay. 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 Thank you. And one last question from my side. What's your opinion regarding of all this placebo therapy and some of the our herbs from the India or the masalas what we are giving, the some turmeric, ginger? What do you think? How much that is beneficial?
If the patient is happy with it, tell them to take it. It is,
Okay.
she's happy, so
Huh.
she feels like it is good. Like in some places, like you can see, oh, I have seen the doctor, so I'll be all right. It is like that. Okay, oh, this is my doctor, and if I see, even if she writes a placebo, but if you see the doctor, the patient tells, oh, the doctor has given, and I'm all right. So it is like that. Okay, it acts you. But definitely these turmeric, we know it has antiseptic properties. Ginger also, we know it has some properties. So it is good to have healthy things. So why not add antiseptic food which will help them rather than giving them any problem. So there's no harm, and it is good thing if they are having. Definitely they should have.
Thank you. Thank you. Thank you once again. So I think I have finished with all the questions. Friends, Dr. Nagpal is not able to join because he just called me while Dr. Maria's presentation is going on. He's still stuck at the traffic. So if there are no more questions, we will wind up for today. Sahiti, are you able to see any other questions?
No,
I
ma'am.
don't. Yeah, yeah. So thank you once again, Maria, for joining with us. And please do drop some time for a cup of coffee.
It was so nice. This was my first talk for the gynecological session, and it is a good experience.
I will keep on calling now.
And thanks, Ritu. Thank for everything. And you are such a beautiful soul. Same to you.
Chalo, okay, dear. Okay, dear.
Bye.
Yeah,
Bye.
yeah. Bye, bye. Thank you, Shield Pharma, for providing the platform, and thank you, dear friends, who all have logged in. Bye.